Hello, I'm Norman Lamb and I'm the ex-Care Minister, now Lib Dem Parliamentary Spokesperson on Health. I'm really pleased that you're there discussing liaison and diversion. I wish I could be there with you, but the diary was impossible. So I was asked to do a quick video clip just to offer a few thoughts. So just go back to when I was a minister. This for me was a real priority. When I came in to my role in the Department of Health, I discovered from a meeting with Lord Bradley that the whole programme was slightly off track and we were falling behind schedule and it was at risk, and he expressed some real concerns about that. So we had some work to do to make sure that we got it back on track and ensured that we delivered it as the coalition agreement had committed to. And I think, we made really good progress then, and I was thrilled when we launched it over 2 years ago now. I remember turning up at a police station somewhere in London to do that, and I think it has enormous potential value. I remember talking to Andy Bell at the time, and him saying to me that there was no other country in the world that was doing it on the industrial scale that we were pursuing in this country. And for me, the starting point is that it's really a scandal of our time that there are still so many people in our prisons who are there essentially because of drug or alcohol or mental health issues, or a combination of the two. And we should be doing far more to address the underlying cause of their offending behaviour and to give them a chance of a better life and protecting the public better. I mean, it makes sense from everyone's point of view. So I'm thrilled by the progress that has been made as we roll this out across the country. I'm frustrated that it's not happening quicker and that we still need another business case before we complete the rollout, but it's better than nothing. And I want to build on what we have now. I did also want to say a word about the West Midlands. I've been chairing a commission on mental health for the West Midlands Combined Authority, working very closely with Sean Russell, who's been the police lead on mental health for the West Midlands, and will now be the implementation director for the action plan that we've published as a result of the Mental Health Commission that I've chaired. Now, in the West Midlands, it's the first region, I think, as a whole that now is completely covered by liaison and diversion services. They've done really well with street triage, with other aspects of the crisis care concordat. And there's another and now exciting element to this, because one of the actions that we've agreed as part of the action plan is to make much greater use of mental health treatment requirements. This is a sentencing option available in courts for people where there is clearly an underlying mental health condition. And we will get it working in 3 courts across the West Midlands. And my aspiration, my ambition, is that we create a sort of coherent single service that addresses liaison and diversion, the whole crisis care concordat work, and the use of mental health treatment requirements at this interface between mental health and the criminal justice system, so that we are much better at identifying someone when they turn up in the criminal justice system where there is an identifiable mental health problem, to get them diverted to diagnosis and treatment, but also to explore straight away whether they may be an appropriate case for getting onto a mental health treatment requirement. It has to be with their consent. But if we can do this on a much greater scale, as they have been doing in Milton Keynes for the last 2 years, then I think this sits so comfortably alongside liaison and diversion. So thanks to all of you for all of the work that you've been doing in this field. There's nothing really more important than this to me. And we can make such good progress at making better use of public resources, making a difference to people's lives, getting this rolled out everywhere across the country, ensuring then that people get access to support quickly to help them address the underlying causes of the offending behaviour, And I think if we can do that, we can make a massive difference to people's lives. So thank you.